Hello, my name is Eduardo Adnet. I am speaking from Brazil. A lot of people, when they are going to give you a sandwich or a food, pay attention. If when they are preparing the food, if they're going to get your money, your cash or credit card with the same hands, without protection, that they were preparing the food, because the hands touching money in food is definitely not a good combination. With 37 years of medicine practice, I believe I have valuable knowledge to contribute with you. I'm a medical doctor and a specialist in medical nutrition. Soon I will be producing videos on important health-related topics that many people, especially those who are visiting or planning to visit Brazil, will find useful. Oh, you will. I am from Rio de Janeiro, Brazil. By the way, a person who is born in Rio is called Carioca, not in the state of Rio de Janeiro, but in the city of Rio de Janeiro. Carioca is a word of indigenous origin that roughly means the house of those who arrived, referring to how the native inhabitants perceived the early settlers' homes as very different, because they had, of course, their... We're going to get to the topic in a few moments. It's not going to be a long video. Today's topic is one of that I consider extremely important fact and neglected. This is a subject neglected, but it's a serious subject. I'm referring to intestinal parasites. It's endemic here in Brazil. Intestinal parasites, commonly known as helminth infections or parasitic diseases. It's very useful that when you come to Brazil or plan to come to Brazil, and I know my country very well from north to south. I have worked as a medical doctor in the Amazon region, Rio Grande do Sul, Rio de Janeiro, São Paulo, Paraná, Santa Catarina, all over Brazil. I have also worked in Europe for a few years. 3 years and a half. Okay, let's go on. Many people who have symptoms of helminth infections or parasitic diseases may experience symptoms like discomfort, fatigue, itching, skin irritation, difficult performing daily tasks, memory issues, exhaustion, gastrointestinal problems, and stomach pain. These symptoms can often be caused by parasitic infections. So in this video, I'm going to be discussing some of the main types of parasites, that's the word, that are commonly found here in Brazil. Their names and possible treatments. However, this is strictly for informational purposes. You should not do anything by your own. Ask your doctor. You should always consult your physician before taking any action concerning your health. Intestinal parasitic infections are endemic in Brazil, and we have a very bad culture, unfortunately, in many places, that you should pay attention if you come to Brazil. A lot of people, when they are going to give you a sandwich or a food, pay attention. If when they are preparing the food, if they're going to get your money, your cash or credit card with the same hands, without protection, that they were preparing the food, because the hands touching money in food is definitely not a good combination, especially when it is related to verminoses or worms. There is a cultural aspect in many food establishments, such as snack bars or beach kiosks, that the same person who handles the food also handles the money. Money can carry parasite eggs, making it a vehicle for contamination. I'm mixing me speaking with the script, but I think I'm not going to need it anymore. But the information is very important for you here. I'm sure you're going to like it when I speak about many healthy issues, because what thing is more important than your health, our health? The trip itself, traveling? No. It's that you stay well, I stay well while we travel. Okay, let's go on. These parasites are typically transmitted through the fecal route way, meaning contamination can occur through food, water, or contact with contaminated hands or surfaces. Poor sanitation and hygiene practice increase the risk of this problem significantly. And I'm going to give you the name of some of the most common worms here in Brazil. And I'm in a moment to tell what you should tell your doctor before you come to Brazil. Some of the most common parasites include Ascaris, caused by Ascaris lumbricoides. This is the number one in Brazil. In Amazonas, Rio, São Paulo, Ceará, everywhere we have Ascaris, Ascaris lumbricoides. It's a worm that is everywhere. Now, it's not necessarily in a sequential order, but we also have hookworms caused by Ancylostoma duodenale, trichiurasis, trichiura, which is that little small worm, tapeworm infections, which is caused by teniasis, giardiasis, caused by Giardia lamblia, and finally amoebiasis, which is the worst of them all, called by Entamoeba histolytica. This amoebiasis specifically is very present in contaminated water, and so you should take mineral water. Don't trust water here in Brazil. Unless you go to the Amazon jungle, but far away, and you take that pure water from the rivers. That's different, but it's not everybody has the chance. I have worked as a medical doctor for 3 years and a half in the Amazonian region, and I could go to help the indigenous people, native people of Brazil, and I have a lot of experience with parasitosis and many tropical diseases. Okay, I'm not going to go too long, but each of these can cause various symptoms, as I know you. For example, hookworms can lead to anemia, while tapeworm infections may result in a serious condition called neurocysticercosis, which means that the egg of the parasite can get to your brain and stay there, and it might cause many complications, including epilepsy, crisis, things like that. You might do your own research about neurocysticercosis. This type of eggs affects the brain. Okay, contamination is more common in densely populated areas, such as major cities in Brazil, including those in the southeast, northeast, and another region. However, these infections can occur anywhere in Brazil. Okay, this is to give you an idea and what you should do. First of all, talk to your medical doctor that you're going to make a trip to Brazil, and ask him to give you a medicine for worms. Why that? Because let's say that you come to Brazil already infected with parasites, intestinal parasites, and you come here and you get them again. What's going to happen? Their quantity is going to increase in your intestine. So if you come with your intestine clean, ask your doctor what kind of... you can also ask your doctor for a medicine that can kill most of the worms, in case when you come back and you are, unfortunately, I hope not, you're infected one of the parasitosis I spoke about, you might be infected and the medicine will heal you. Well, I'm sorry, but my voice is not very well today because here in Rio it's very hot. We get into a better period where it's not that hot, but I have to use low temperature air conditioning in my office because of the machines, of the computers, because they become too hot, and also because it's hot here. So I hope this information was useful to you. If you like this video, please comment something. This is just a better version. So I'm making mistakes, I'm just beginning. But I am sure that there's not a lot of people talking about health issues for those who pretend to come to Brazil. You are encouraged to come. Brazil is a very beautiful country, amazingly beautiful beaches, forests, and people. Food is spectacular. You might know it. But about health issues, well, that's Eduardo Adnet going to be speaking with you more. If you like the video, give a okay, I like it, and we will continue soon. It was a great, immense pleasure to talk to all of you, wherever you listen to this small video from. Thank you very much. Goodbye. And I'm a Christian. God bless you in the name of the Lord Jesus. Ciao.